Well, my initial reaction is this is the first time I finished an exam this early, and I just don't feel like staying on campus to, do my little post-exam debrief. So I'm just gonna go walk right over to the gym and get my swim on because it's raining, it's cold. I'm dressed like it has, like the temperature's been for the rest of the week. And when it was like 50, I think when I left the house this morning, it was a wind chill of 32. Like, girl, act like you're from Chicago. Hey y'all, welcome back to Madeittomedicine with Vicks. That's me. I'm a third year medical student. I just took my neurology exam and I don't think it was that bad. So I'm gonna walk y'all through all of the main topics that were on the exam, how I prepared for it, and where do we go from here? What's next? What's going on with my life? So yeah, let's get out of this rain and then we'll talk about it. All right, so number one, how I studied for the exam, I think there were roughly 250 UWorld questions, and this was a 4-week rotation, which was the shortest of all the rotations I've ever done because each is typically 6 weeks with surgery and internal medicine being 8. And so the goal was to finish UWorld within the first 2 weeks of the clerkship, and I successfully did that. This was actually the first time on any clerkship where I didn't goof off the first 2 weeks because I didn't have time to do it. So I finished the UWorld questions, and then I was supposed to finish all of the NBMEs, which is the National Board of Medical Examiner. So the people basically who write the exams that we take, I was supposed to finish all of those by the end of week 3. That didn't happen. I finished the last practice test yesterday morning. I had started it Wednesday, but I didn't finish it until Thursday morning because I was too tired Wednesday to finish everything. And I was also supposed to go through UWorld a second time. I did not do that, but I did go through the spinal cord lesions and the neurodegenerative diseases twice. I did that yesterday because I was getting those questions wrong often, and I kept up with doing my incorrect questions throughout. So if I would do a block of 20, which is what I did roughly every day for the first 2 weeks because it wasn't that many questions, so I didn't have to beat myself up and force myself to do 40 questions a day. So I would do this block of 20, and maybe 2 days later, let's say I got a 50% on that block. And honestly, in the beginning, I was getting 30 and 40% correct because it was just so foreign to me. 2 days later, I would address my incorrect questions. Man, this wind is crazy. So let's see, I do think that was helpful. Obviously, it's different now because as a third year, I was about to say a second year, Lord Jesus. My first 2 years, I had a peer tutor, and third year, I haven't had one. I think I had it for maybe the first 3 rotations, and honestly, I don't think it was as helpful because I don't think the tutors knew the information as well as I was, as close as I was to the material, then I was closer to the material than they were. So I was seeing their flaws and when they were making mistakes more. So it was kind of throwing me off versus being beneficial. And although it was beneficial for the first 2 years, I was just well, it's not helping me anymore. So that's really a hand at, if it ain't working no more, drop it, figure out something else to do. So I typically just study with a friend, but we also didn't study as much during this block because again, she's in grad school, and this wind is actually about to blow me and my nose running. So let me finish this thought, then I'm gonna have to come back when I get home. But she's in grad school, and she literally just went back to school this week on Monday, during my exam week. And all that's to say, I had to be really motivated to do these questions on my own, but also ask people help, asking for help when I needed it, because I know that I work better studying with other people. So I stuck to, doing what I know works best for me. All right, it's kind of cold. I'm gonna come back though. So going into the exam, I always ask students who have previously taken it, what are the high yield points that I need to know for the exam. And once somebody told me that a find the lesion question. They only had like 2 of those, which I found very hard to believe because when we learned neuro and behavior, so neurology and psychiatry, in my first block of my second year, it was our longest block of medical school at 10 weeks long. And I believe 7 of the 10 or maybe 6 of the 10 weeks was neurology. And on that exam, a lot of the questions were find the lesion. For example, they could say someone got stabbed in the back on their right side and they lost pain and temperature on the left leg, which is contralateral to where they got stabbed, if it was stabbed on the right. And then they lost sensation on the right. And what is the other one, Lord? And I don't have my glasses on, so I can't see my board. What does that say? Ipsilateral sensation. Yeah, I said that already. And then I can't see. I don't have my glasses. But basically, it's proprioception, vibration, and sensation. That'll be ipsilateral. And then pain and temperature will be contralateral. There's another spinal tract that you lose on the same side as the lesion, which should be corticospinal. So motor. Yeah, it's motor, sensation, proprioception, and vibration. That's ipsilateral. So it's the same side as the lesion. And then pain and temperature, the opposite side, contralateral to the lesion. So if they tell me someone got stabbed on the right and these are the things that they left, like lost left leg, they can't feel pain and temperature, but they have sensation. And the right leg, well, at the left, they can't feel pain and temperature at the level of the umbilicus, so the belly button. But on the right, a little above that, they have no sensation right at the level of the lesion. And below it's no motor and also no proprioception, vibration, all of that. So by me saying find the lesion, I have to know that if at the belly button is where there's no pain and temperature, the only thing that you lose at the actual lesion is sensation. So that has to be somewhere around like T8, so thoracic level 8 of the spinal cord. So that's a find the lesion. Or if someone has a stroke and they have facial weakness and upper arm weakness, and strokes are typically only on one side because it's very rare that you have a stroke that occurs on both sides of the brain. It does happen because I definitely had a patient while in the hospital on ICU, but it wasn't my patient, it was one of my friend's patients, but they had like a stroke that went everywhere. It was multiple strokes throughout the brain. So we didn't really know the weakness, obviously, if a patient is unconscious, and they had to come from an outside hospital. So all that to say, the medial cerebral artery is responsible for the facial sensation. And so it's responsible for the face and the arm. And then the ACA, anterior cerebral artery, is responsible for the lower legs. So I'm going to put a picture of a homunculus on the screen because this really helps to localize lesions, especially if they're in the cortex, which is the brain. So it was tons of questions on localizing the lesions. It was tons of micro. And at some point I kind of got confused. Like, and with microbiology questions, they're going to either ask you what's the pharmacology. So what is the medication, the drug that you're going to give them, or what is the next best step in management? Earlier, I think on my TikTok, I talked about how anatomy was, to me, a sleeper on this exam. Like, even preparing for the exam, UWorld questions. So this is why I'm never a proponent of, oh, just do all of UWorld. You never have to do any practice exams, just do UWorld. No, UWorld is a learning tool. Yes, they're going to expose you to a lot of the content, but UWorld is not the test writer. So that even goes for people studying for the MCAT. Yes, it's cool to get Kaplan, Princeton Review, Exam Crackers, Blueprint, and whomever else is out there, right? Because you want to do as many practice questions or as many practice exams that you could get your hands on. But the end all be all, the best people that are going to assess your knowledge and your readiness for the exam are the exam writers. So that would be the AAMC exams, AAMC practice questions, AAMC practice passages. All of that is going to best prepare you, right? So that's why I took every single NBME I could get my hands on because they write the exam. So although on UWorld, the only anatomy question that they would give us was common perineal nerve. So that was like if someone typically sits with their leg crossed and now they're lacking dorsiflexion, so they're lacking the ability to raise their foot up. And it was something else like pain at the knee or some crap. I'm not really the best with anatomy still. So like, yes, they're working on it. That's the only question I got on UWorld. But on NBME, they could say something like, oh, unable to move the thumb, pointer, and middle finger, so the first 3 fingers, and I'll have to know, okay, which side of it are they unable to move? Because this could be the radial nerve, this could be the median nerve, and more times than not, it's median, because median is definitely these 3, and I think like half of that one, and then ulnar nerve is this, the pinky, and then half of the ring finger, and then if it's carpal tunnel syndrome, doing Phelan or Tinel test, that's going to say whether you have carpal tunnel, and like, what's the next step for carpal tunnel? Are you going to do a wrist splint? Are you going to give a corticoid shot? Or are you going to immediately go for surgery? Like,
like, these are the type of questions that you get, and that's like a first order, second order, or third order question. And knowing the difference between cervical radiculopathy and spondylosis. Fun fact, I went to the doctor in December because based on my surgery rotation, I was like, oh, this pain that I'm having in my neck and my arms is giving, do I have cervical radiculopathy? When I got an x-ray, and I got a cervical x-ray, and they said like, oh, it looks like it's mild spondylosis of the spine, which is giving mild arthritis in my spine. I'm too young to have arthritis. So that's why I'm in physical therapy, because I'm trying to get my life together. But on this exam, it's a lot of questions like that. Like, is the answer cervical radiculopathy? Is it spondylosis? Is it spondylolithiasis? Is it spinal stenosis? And then when you're on the exam, if you don't really know what each of those mean, you're gonna kind of get tripped up and very, very quickly. Something that was a big surprise to me was the amount of pediatric questions that I saw. And at some point I was almost like, how does this relate to neurology? Like, I can understand if I get a question on meningitis in a kid, or like GBS, so like sepsis, neonatal sepsis, because that's messing with cognition, cognitive functioning. But other than that, like, I'm kind of confused how I'm getting a renal question and it's not connected to the brain in any sense. Like, what are we doing? That was interesting. Knowing imaging. So I've been really, really not good at imaging since we first got introduced to it at the beginning of medical school, but I never took the time to learn it, because if I'm not good at it, how can I teach myself? And I know someone can be like, oh, well, you could just watch lots and lots of slides of MRIs, of CT scans, of chest x-rays, of angiograms. You can just watch them. But I'm like, honestly, that's not the way that I learned. So in that vein, I was kind of forced to learn it on this rotation. Like, I remember being in clinic my first week, and the way they give you the imaging in the EPIC system, which is the electronic medical record system, they have the images, but there's also an impression read by the radiologist. So what I'm used to doing is scrolling all the way down through all the things that the radiologist says that they find, and go down to the impression at the bottom. It's going to be between 1 and 4 things, like 1 and 4 numbers that they're going to tell you. Like, oh, for example, if it's a stroke, it's going to say no ICH, no intracerebral hemorrhage, which if they come in with the ischemic stroke, the first thing we do is a CT without contrast, because contrast and blood both are going to show up as white, and we need to see if there's a hemorrhage on the scan or not, because if it's a hemorrhage, we can't give TPA, but if it's not a hemorrhage, we need to give TPA. And if it's an occlusion, which could be oppression too, there's occlusion at the M1 of MCA, so that tells us exactly where the stroke is. It's at the first branch of the middle cerebral artery. And so now we'll take them to the neurosurgeon suite and give a thrombectomy. And by we, I mean them as in the surgeons. Neurology team, obviously you're not surgeons, so we just do the CT, give TPA via pharmacy, and then take them up to the neurosurgery suite. So on stroke and clinic, everyone's like, oh no, we don't read impressions. You don't trust someone else's word over your own word. So yes, it's great that the radiologist has done this, which yes, obviously radiologists are trained physicians as well, but this is your patient. Like, radiologists are doing reads of hundreds of patients throughout the hospital. And you, as someone who's a specialist, need to know what you're seeing. So I had to get good at that, which was great because there were tons of MRI images on the exam, tons of CTs, not as many chest x-rays or CT angios, and the angio is going to look at the blood vessel, and that'll actually show you whether it's narrowing or if it is very wide or not. So I thought that was good and very pertinent thing that I picked up on this rotation. Like hydrocephalus, which the mnemonic that I learned maybe my first year of medical school is wet, wacky, wobbly. So if I see someone in the vignette that comes in with urinary incontinence, that's wet. Wacky is like some type of neurological confusion, and then wobbly, they have instability in their gait and their walking, so ataxia. So if I see someone with those 3 things, I'm like, oh, this is going to be hydrocephalus. And so in hydrocephalus, your ventricles are going to be widened because the cerebral spinal fluid, CSF, is not able to be absorbed properly. Like, some place in the pathway is blocked so that it's getting so full and causing these conditions. I'm trying to think something else that was kind of prevalent. There were a couple of OB-GYN questions, like on my practice exams ahead of time, there was a question on, or maybe it was like there was a question and wound up being preeclampsia, but I'm just like, there is no way that preeclampsia could be the answer, because preeclampsia, is that really neuro? But I guess it could be neuro since we're talking about higher blood pressure, and it can cause altered mental status. And let me see, what was else I was going to say? Yeah, obviously altered mental status questions are there. And I already spoke about neurodegenerative disorders in my study day vlog Alzheimer's, vascular dementia, frontotemporal dementia, Lewy body dementia, Parkinson's dementia, or just Parkinson's, Creutzfeldt-Jakob disease, all of those things. And there was one more thing that I really wanted to say. Obviously now I can't think of it, and that's crazy. Yeah, like after I take an exam, the information like high key escapes my mind, and I can't tell you like exact questions even if I do remember them, because it's like there's an agreement on the exam that you can't replicate any information. So I can just tell you like topics from what I've seen on my practice test or my practice questions and how that correlated or corresponded to the exam that I actually took. But all in all, I felt like it was a very fair exam. I was gonna say there's only been one shelf exam I thought was hard. That's a lie. Even when I think exams are hard, I think they've all been fair. So yeah, I haven't thought anything has been unreasonable. I'm really hoping for the pass, because that'll be one step closer to completing my third year exams. And once I get to fourth year, the only exam that I have to take is step 2. And I'm loving that for me. But all in all, if you focus on being able to locate the lesions, knowing exactly what each spinal tract does, knowing neurodegenerative disorders, altered mental status, learning some anatomy, like I'm talking nerve roots. Oh, that was something that actually ticked me off. In physical therapy on Thursday, my therapist was like, oh yeah, next time we're going to go over the brachial plexus. And I was like, girl, the way I don't even remember that. Let me review that tonight. Did not review it, and needless to say, it came to bite me in the behind. Can't really remember the question, but I know that brachial plexus was there, and I was like, I can see it a little bit in my head. I can see the nerves. I can see the roots. I can see the trunks. But where's everything connecting? I wasn't really seeing it. Like, yeah, I can see C5 to T1 and musculocutaneous at the top, median at the middle, ulnar at the bottom. And then coming off of median is like radial and axillary, I believe. But that's all I had. And I was like, okay. But that's also just one question, so I'm not going to trip on it. But yeah, like knowing difference, like since neuron psych were exams that were linked together, like when I was in my preclinical years and as a second year, knowing the difference between when someone actually has a neurodegenerative disease versus is it just major depressive disorder. And the main way to see that is if they have anhedonia, which means loss of interest in doing things that they enjoy. So typically a question to go from like, such and such buried their loved one or like their spouse 6 months ago, and now they no longer like to garden or hang out with friends. Their sleep pattern is messed up and, like things of that nature. So that would be more of a major depressive disorder than a dementia. But neurology taught me so much. I do not see myself being a neurologist. I will not be applying neurology at all, but I did learn so much. And the further that I go into medical school, I am seeing that there are multiple specialties that will allow me or provide me with the opportunity to practice medicine. It's not just neurology things here. Oh, yeah, seizures. Yeah, you gotta know the seizures. And there were several seizure questions like partial seizure versus complex partial versus absence versus grand mal seizure. And what do you do? Is it an EEG next? I believe so. You need to put them on an EEG. Or if they have seized, lost consciousness afterwards, having like a dizzy spell in between, as in like days, don't really know what's going on, and then they regain, that's a post-ictal phase. And if they seize again, you want to give them some type of anti-seizure medicine. And in the hospital is always Keproso, levetiracetam, so that they will not continue to have epileptic episodes. But I say all of that because I didn't just have neurology patients during this rotation. I did have some psych consults, had consult from general internal medicine for like addiction medicine cases or heart attacks as well. Also, like the eye is included with neurology. So optic neuritis, which can go into NMO versus multiple sclerosis, or even on what transverse myelitis is. And if someone has an upper respiratory illness and now they have ascending paralysis, it will always be Guillain-Barré, which is induced from Campylobacter jejuni, which is a bacteria. All that to say, coming into medical school, I wanted to be a surgeon, and I was almost surgery or bust. Like first year, I literally almost said that. Like from 5th grade, I wanted to be a surgeon. It's a great day to save lives. It's a beautiful day to save lives. Dr. McDreamy on Grey's Anatomy, that was me. It was my inspiration and my pediatrician, and not really thinking. Actually, I think I did at a young age think about like the lack of representation, but I didn't really call it representation. I just knew my doctor didn't look like me, even though she was nice. But it would have been easier for me to talk to my doctor if she looked like me, kind of related with me, and had some cultural similarities She didn't. My doctor was an Asian woman, and sometimes she did look to my mother for answers or approval, and I do kind of wish that she would have kicked my mother out of the room because maybe that would have given me a little bit more autonomy. But she was a nice physician, and from there it sparked more of an interest in medicine. But for some reason I thought the only way to be a true doctor was to be a surgeon. And also, when you come from the hood and you come from, like, I don't know, everyone these days says that they're middle class. Like, yeah, maybe now my parents are middle class, but growing up, I felt like we were not middle class, we were underclass. And so when you come from nothing, you always want something. And I just knew that surgeons will make a lot of money. But to me now, money is not really the biggest thing. And all physicians are going to make money. The level of what you make is going to be relative to someone else. If I say I come out, I'm making $220,000, to me, that's a lot of money. Somebody else might say, well, $600,000 is a lot of money. Whatever. Everyone suit your own boat. But all that to say, I don't want to go into surgery anymore. When I did shadow orthopedic surgery my first year, I was thinking this isn't good enough for me because it's all just scheduling surgeries. And I like a big part of medicine to me is building a rapport with your patient. And I just really want to build a rapport. I want you to come in, even if it's just once a year and we're catching up, or once every 3 months, once a quarter, twice a year, whatever the time may be. I want to be able to establish a relationship with you. And I am now seeing that there are also procedures on the other side. I almost got to see a lumbar puncture on this rotation. They just weren't able to get this CSF, so I didn't get to see it. But something procedural is interesting to me, and not something that's necessarily all surgery, or surgery is like 80% of the job. Surgeons do also see patients. Like when I was on neurosurgery, we definitely had rounds every morning to see the patients in the ICU. But I'm just like, want y'all to know, or like think about the different levels of these specialties. It's medicine based. Like everything is medicine based. And I can't say that I don't like that. Like having to use my brain and think about other things, even if we're just a consult patient. I'm like, I understand we're only consulting for the brain, but their creatine kinase is really high. Like it was 1,300 yesterday, and today is 4,800. It's giving rhabdomyolysis, like muscle breakdown. Like we need to probably alert their medicine team about this, because yes, you can be in one field, but this is still one body, one person, one human being that you are caring for. And that's something that I think that we all need to think about a lot more while practicing medicine, that these are people and we need to treat them with the utmost respect. If you have any questions about the neurology shelf exam, whether that's tips on how to prepare for it, I am going to give y'all a video on how I break down questions. I know in the previous video you saw me like reading through some questions and like reviewing my notes, but I'll give you like a screen by like side by side of how I read the questions, diagnose, and give my differentials before I get to the answer choices, and even like just my whole setup. I'll get that out for you soon throughout February. In February, the goal is to drop 2 videos a week. So let's see how much I can stay on top of that. And some of these weeks I have some pre-med content coming out as well. So shout out to all my pre-med folks who have stuck with me. Thank you for following along with my journey. And I'm hoping that I'm able to help you move further on with your journey. I will catch y'all in the next video. Oh yeah, I'll let y'all know what I'm applying when I apply, but keep dropping some guesses down below. I really like to hear your thoughts behind it too. Catch you next video. Bye.